Hi, my name is Dr. Anton Babushkin. I am the Director of Wellness Psychotherapy. Wellness Psychotherapy has a contract with the Wayne County Medical Society to provide psychotherapy mental health services. And as a member of the society, your first session is free. The following video after this brief intro has to do with taking care of yourself. How can one take time during this very busy pandemic to practice good self-care skills, to pause, to sort of set realistic limits on what can a person do in any given day, and how can they stop and make sure they have time for themselves and their family. Hope you like the video. Our contact info is on the website in case you'd like to take advantage of your first appointment. That's free. Okay, take care.
So my name is Arjun Rama. I'm a psychiatrist in private practice in Madison, Wisconsin. I see patients typically in the young adult range, but my patient population extends all the way into the geriatric range as well. And I've worked primarily as an outpatient psychiatrist, but during my training, I spent time on inpatient services and in the emergency room.
Yeah, that's great to know. I mean, I can kind of relate to that. So just to give you a quick, my bio, so my name is Anton Babushkin. I'm a psychoanalyst in Michigan.
Mhm.
I run a private clinic, so I have 10 therapists that work with me at my office. And we have 3 locations. We have a location in Troy. We have a new office in Detroit, which is closed now because of the pandemic. And then we have, we also work with businesses, so we do like on-site therapy for businesses. So kind of like what you're saying, I mean, primarily now I work in the outpatient environment, but I have certainly worked in different hospitals, like at psychiatric emergency rooms.
Sure.
So I sort of, even though I've been out of that world for a while, I can kind of imagine what does it look like to be in these sort of tense spaces, right?
Mm-hmm. Mm-hmm.
And so we were going to talk today about some of what's it like to be a medical professional during this time of the coronavirus, working in whatever hospital or maybe outpatient setting, and dealing with the stressors. I know you mentioned earlier when we were chatting about some of the themes that sort of maybe one can tease out of what it's like to work in these environments, right?
Yeah, absolutely. When I think about it, I think about our jobs as healthcare professionals. There's issues particularly around limit setting, about what we can do realistically as people who are trying to be helpful but also trying to be self-sustaining. And I think that what we're facing now, which emergency physicians and people who do trauma work face all the time, but I think we're seeing it to kind of a new level in this moment where things are coming so fast and furious, which is how much can we realistically expect of ourselves, and at what point can we say that we've topped off our limit on it?
Right, for sure. I mean, I was reading this article today, actually, in the Wall Street Journal, by this guy I like a lot. He's usually a sports commentator, Jason Gay, and so he now, because there's no sports, he sort of writes these columns about how he's managing the pandemic.
Yeah.
And he wrote this thing today about, I haven't run the mile, I didn't invent a new Rubik's Cube. In other words, saying like he had all these ambitions he was going to like cut weight or I don't know, do something crazy during this time, but really he's still the same guy and trying to just manage day to day. And so I would imagine for these medical professionals, on the one hand, we as a society are we're sort of dependent on them. We're saying, oh my gosh, there's this very crazy virus. Nobody knows what to do, and we're counting on them to help. But what's it like for them? What kind of pressure do they feel day to day? And how hard it must be for them to be like realistic about what are my own limits, like you said, right? What's realistic for me? When I come into work, how many patients can I help? Or how much time do I need for me, right? I mean, those must be really hard questions in that environment, I think.
Well, and I think that when something, extraordinary is happening, it's so, we have this urge to try and be extraordinary and superhuman. But the thing is, like, we still have all of our regular stuff. Like, we still get fatigued. We still get anxious. We still get scared. And all around us, all the rest of life's machinery is still turning. Like people who have partners and kids, and particularly in a situation like this, our kids are at home frequently because all the schools are closed. And
Right.
so then, this is in a lot of ways, as outpatient clinicians, Anton and I have already like seen, and I know for myself, I've sort of seen some of the strange limits you see there, which is to say, I'm trying to see my patients by distance, and I'll have my kids screaming and crying in the background, and I'm trying to maintain like a professional demeanor while I'm seeing people.
Mhm.
And so it's interesting that these limits, I think, are faced in every sphere. But
For sure.
what I think is happening for our inpatient and emergency folks is like this whole new level. And that's the part that I think that limit setting takes on like a whole new importance because it's absolutely frontline.
Right, and then we were also chatting about like what does one do with all those feelings of whether it's anxiety, frustration. There's a lot of like posts online about medical professionals saying we need help, we don't have enough personal protective equipment,
Right.
or so I know some people like in my neighborhood are collecting money to bring meals, to nurses or to doctors to the hospital to kind of give them a break or give them, something to kind of look forward to, right? So we were chatting about like what does one do? What do you do with all those emotions? You're at work for 12, I don't know, 16 hours a day, and maybe you can't really talk to your administrator about the administrators are under pressure to make sure that we're doing the best job possible. The whole country's watching, right? So what do you do with those emotions when you're under so much pressure?
Yeah, and I think what makes it even more complex is I think about like the kind of work that you and I do, which is um, especially a more formalized psychotherapy relationship, which
Right.
is hard to establish even under good circumstances. It's like issues of time and scheduling. But we're in this acute situation where there's a great need, and I think even the logistics of it get complicated because people are fatigued and they're like only home, after 8 p.m. and into the middle of the night, and so the idea of having the kind of routine that some of our psychotherapy patients might be accustomed to, it's like not available right now, and or it's not easily available based on the craziness of people's schedules. So I just think of it as fortunately there's been a push for physician helplines that have
Hmm.
been going up online
For sure.
that have been on a kind of ad hoc volunteer basis from psychiatrists and psychologists and social workers to prepare, or sorry, to provide some
Yeah.
support. And I think
Right.
that I'm not sure if those are circulating as much as they should, but I think everyone's trying to put it together.
Right, exactly. Part of it's kind of a question of advertising. How do you get that
Yeah.
information out to the community? Because yeah, like here, I know in the Detroit area, there's a group like that being put together. There's actually a discussion tonight about for like the suburbs of Detroit. I
Yeah.
know that the Ann Arbor area has a group they're putting together. So I think most probably psychotherapy communities are thinking of, I know there's some conversations in like an online groups about how do we
Yes.
help, how do we make time available. We could do like brief appointments, something to kind of be supportive. But I think people don't always know, one, that it's available, and two, they might say like, well, how is that going to help me? Because I think people don't always, I think, without kind of having the experience of being in therapy, I think they might not know how much a therapeutic relationship could help contain that, right? I mean, what's the goal of a good therapy? It's to both give voice to
Hmm.
what's troubling me, to kind of contain it in a way, make it manageable, to
Yeah.
think of ways how one could deal with it. I think not everybody has had that kind of positive experience, and so they might not even think to turn to that kind of help, right?
Oh, totally. And I think about it as it may be feeling like actually very in opposition to the way one views work. I mean, I can imagine for an emergency physician or folks who are doing other kinds of frontline work, it's the idea about being productive and being like doing the right thing as being very hands-on and action-oriented, as opposed to taking time for oneself to be reflective and
Hmm.
being in an environment that's supportive. Because that's like the cool thing about emergency services. It's like that's who you go to when you're losing control, right? You come in for an emergency,
For
and
sure.
so I think we're in this unique situation now where it's like we are trying to provide a holding and supportive environment for people who are, frankly, just getting totally overtaxed by our system.
Yeah, I think you're right. I mean, I think that it's like if I'm you, how does one value that? How does one kind of make time for oneself or reflection or think when
Yeah,
when there's so much pressure, and two, when my day-to-day life means being, very decisive and making
yeah,
very quick decisions, that if that's what I'm doing day to day and I know that's what works, how do I actually step back and think like, is this kind of talking things out or
yeah.
looking for reflections actually going to do anything for me? How is
Right.
that
It's
going to
like
solve?
it almost seems like it'd be the opposite, but I actually think that this comes back to what we were saying before. It's like I think it layers on nicely with the idea of that's part of the limits. It's like
For
I
sure.
think this idea of being totally action oriented, totally focused on like a very tangible product, like managing someone's shortness of breath, respiratory failure,
Hmm.
issues of life, quite literally life and death settings on the ventilator. I can imagine that that would be one might feel uncomfortable with the idea of the value of actually saying like this is as much as I can possibly do without totally burning out, and I need to take a step back and actually be um, reflective and also vulnerable about, like we were saying before, about some of the strong feelings that are going to come out. Terrible fear for our families, um, perhaps even in an apolitical sense, like rage at a system that
Hmm.
may have not prepared us or delayed things in such a way that the problem became worse, and now we're pushed as frontline people to have to clean it up essentially. Um, but I think that the trouble, if you can call it that, with concerns about duty is that it's like, well, I'm supposed to put all that stuff aside and do my job, and I think that there's absolutely merit to that. But um, to be an effective member of this team, I think taking time and energy and devoting it towards self-preservation is like maybe one of the greater investments you could do during a time like this, you know?
Right. I think you're right. I mean, it's kind of like I don't know how this happens like in your practice. I know that
Yeah.
working by phone through the computer,
Yeah.
taking even a half hour during the day to like recharge. Sometimes I'll go outside just to like
Yeah.
breathe some fresh air. I might not even go for like a long walk. I just kind
Yeah.
of because I'm in this cramped space, sort of at
Right.
home, working in front of the computer camera. I feel like that sort of recharge often helps me be more productive for the rest of the day. I mean, it's like a small thing, but it's something that I know it makes a difference. So
Yeah.
I don't know, what it would be like to have people dying right in front of me in the emergency room. I can, it's obviously like a different kind of setting, but I can only imagine, like you said, that sort of recharge. It's like sleep. You know what I mean? I guess we live in a society where the ideal seems to be I don't need much sleep. I
Right.
could
Like
work
work
a
all the
ton.
time.
Right, exactly. I could run three companies while kind of like sleeping for 2 hours a night while being a family person. But in reality, those recharge moments actually help us sometimes do our best work.
Yeah, and I think it ends up coming down to the parts that are the rest of our lives that I think can seem like they're getting not the same value right now, because I know like for all of these ER doctors and everybody who's doing this kind of work, like all the wheels of their lives continue to turn. I mean, it's and as we
Hmm.
were saying before, I know that people who are not used to having their kids at home for that, 6 hours a day times five, 30 hours of extra child management a week, and
For sure.
multiply that out by two, three, four children, while you're not making any more money or getting any more time to manage and be with them. It's like it can be really hard to say like, well, I'm going to take this time out to meet with my, if I'm seeing a psychotherapist, or to, you know, call
Recovery.
into a physician helpline. Yeah. Like it's so hard to say that because your kids are still asking you for all the same stuff they were, except possibly even more because they're all cooped up now.
For
You know?
sure. Right. It's easy to feel guilty, I think. Like am I sort of underperforming, whether it comes to my job or helping
Yeah.
save lives, or
Yeah.
shouldn't I be spending time with my family or my children, which they all do matter, obviously, right? I mean, there was I was reading this really nice piece in the news about these physicians. They were kind of telling their personal accounts of what their day looks like,
Yeah.
and many times their day would end with, I'm coming home to my family and I have to like sleep in, I don't know, the guest room or whatever, and I can't be exactly. That's right. And so it made me almost cry just kind of reading these stories of how, just like you said, they're still trying to live a normal. They want to be helpful and do what they can, but they still want to live a normal life and be around their own family or their own support network and still kind of feel alive. It's such a hard balance.